what's wrong? What's wrong?
The crewman has suffered severe burns from contact with scalding water.
Tom! Hey, I need you. Kai's burned his arm.
Immersing the tissue in cold tap water minimizes further burning and relieves pain.
I gotta get that coat off. Come on, sit down right here. Sit down. Okay, I'm gonna cut this off real gently. Okay, turn your hand a little bit this way.
Gently remove the crewman's glove, taking care to cause no further tissue damage. The blisters reveal a partial thickness burn, sometimes referred to as a second-degree burn.
Hey, John, bring me a bucket of ice.
Burns limited to a small area of the body can be cooled by immersion in ice water or the application of ice compresses.
Okay, put it in the water, all the way down in. That'll feel better. Don't freeze it. Take it in and out. Okay?
Large burns that cover an entire extremity, the chest or the back, for example, cannot be cooled in this manner because of the potential for rapid loss of body heat.
It's a good thing you put your hand underneath the water right away, or this would have been a lot worse.
Cover large burns with a burn blanket or clean bed sheet, which can be moistened with sterile saline or clean tap water. Subsequent evaporation will provide the necessary cooling effect.
It hurts. Well, that's good, it hurts. It means the skin's still alive. We're going to check it out a little more carefully here.
Utilize self-protective equipment. Evaluate sensation in the burned area using a sterile device like this cotton applicator.
Okay, let me see your hand.
Guard against infection by taking care not to introduce bacteria into the damaged area.
You feel this?
Yes.
You feel me touch you?
Yes.
Okay,
The presence of pain and sensation is a positive sign that means the deeper layers of skin and nerves have survived the injury.
How about here?
Examine the area carefully for full thickness or third-degree burns that extend completely through the skin and perhaps to deeper structures. Areas of full-thickness burn injury typically appear like untanned leather. They are stiff and demonstrate no sensation.
Okay, now you've got some second-degree burns here with the blisters, and we're not going to break those blisters.
Intact blisters should not be ruptured.
We're not going to scrub this unless it was really dirty, because we want to leave this intact.
Ruptured blisters are revealed by the drainage of a clear yellow fluid that is part of the body's defense system. If you detect ruptured blisters or loose superficial skin after a scalding burn, consult with the physician. He may recommend that you gently remove them.
Are you allergic to any medicines?
No.
Okay, when was your last tetanus shot?
Ask the crewman about allergies and prior medical conditions.
Okay, I'm going to give you a pain medication shot, okay?
Okay.
All right, you're not allergic to morphine.
Administer narcotic pain medications like morphine in strict compliance with your vessel's medical policy or after conferring with the vessel's consulting physician. Morphine is a powerful pain reliever. However, administration of excessive doses can be dangerous. Discuss the appropriate dosage with your physician. Purge excess air from the syringe.
Okay, I'm going to give you a shot here, Kai.
Okay, Doc.
Identify the upper outer quadrant of the crewman's buttock. This is a safe area for intramuscular injection. Prep the skin with alcohol or another antiseptic. The recommended needle size for this type of injection is 20, 21, or 22 gauge with a length of 1 to 1.5 inches.
Relax the muscle.
Relaxation of the muscle helps minimize pain associated with the injection. Plunge the needle into the buttock rapidly with a single motion.
Okay, here goes.
If the crewman experiences excessive pain or an electric tingling down the leg, or if you can feel that the needle has struck bone, remove it immediately without injecting the medication. With the needle in place, pull back on the syringe plunger and look for blood return, which would indicate that the needle has struck a vein or artery. If blood returns, immediately remove the needle without injecting the medication. Here's what the injection looks like in real time.
Okay, here goes.
Cover the injection site with a Band-Aid or sterile dressing. Discard the needle and syringe in a sharps box. Continue icing and cooling the injury until the pain medication has reduced the crewman's discomfort to a level he can tolerate. Once the pain has subsided sufficiently, apply a burn dressing. If you find it necessary for the maintenance of rigorous cleanliness, replace your latex gloves with a sterile pair.
Now this burn dressing is antibiotic, and it'll get warm for a while, and then it'll start toning down the pain, okay? But it's going to hurt a little more for a little while.
Silver sulfadiazine is a sulfa drug. Before you apply it, make sure the crewman has had no allergic reactions to sulfa medications.
Once again, you're not allergic to anything.
Silver sulfadiazine, which has a soothing effect and fights infection, is the preferred cream for use in treating burns. If this medication is unavailable, antibiotic ointment can be used as a substitute. Do not apply petroleum jelly or other liniments. If you're in doubt about whether to use a medication, consult with your physician first. Apply the medication with a sterile applicator, taking care not to damage the tissue.
Is that sore down here?
To ensure sterility, use the entire tube or jar of medication as you apply the dressing and discard whatever is left over. If you plan to use only a portion of a large supply, don't contaminate the medication by returning a contaminated applicator to the container. Remove an adequate quantity and reseal the container before beginning the application. Apply a bulky, loose-fitting dressing to cover and protect the damaged area. Leave the fingertips exposed so you can continue to monitor blood flow to the crewman's extremity.
Okay, turn your hand over.
If the fingertips begin to appear blue or discolored, blood flow may have been constricted by swelling or by the bandage.
Starting to feel a little better.
If discoloration occurs, remove the bandage and recheck the fingertips. If the color returns to normal, reapply a looser bandage. If the coloration remains abnormal, contact the consulting physician immediately.
Once again, I want you to be real careful with this and keep it up in the air. Higher than your heart. Okay, turn it over. Okay, now we're going to get you up, and I'm going to help you up to the stateroom. You be real careful you don't fall down. If you start feeling weak, like you're going to pass out, you tell me, and we'll just sit you down right where you are.
Great.